Hi class, welcome to week 3. This is Dr. Halstead. I wanted to say a couple things about all the discussion and assignments about the recovery model. You guys did a great job figuring out what that was and articulating that, and I really appreciated the discussion and the insights you showed there. So the reason we're spending this much attention to the recovery model is it really articulates the aspects of these postmodern models of therapy. So as you've seen, the recovery model and its influence on the medical arena, which includes mental health, really brought in the perspective that the client or the patient really had something to offer. So they have expertise in their story, they can be part of the treatment plan, and they can be listened to and be brought into the recovery. So that's very important because as we move into these postmodern models of therapy, you'll see that those are some of the foundational assumptions for each of these models. Solution focused, EFT, collaborative language systems, narrative, EFT. They're all, I guess we don't do EFT in this class, but they all are based on that premise that the therapist and the client system, as either an individual or a relational system, are working together. And so sometimes we're faced with clients who are very comfortable with the medical model, and they come in and want us to give them an answer. And so we have to educate them away from that. And that's why it's not good to just give advice, because that does not invite them into the healing process. And then next time they have a problem, they have to come back. We're not empowering them to work on their own issues and problems. So that's why all this attention to the recovery model. So I'm glad you've got a good handle on it as we move forward. So this week, we start looking at some of these major models. So this week is solution-focused therapy. So the major assignment this week is fairly light. You're going to be articulating different interventions from solution-focused therapy. So primarily the questions. So there's a lot of different ones, and you'll find them in the reading. I want to keep encouraging you to do the reading. That's the way you get the material for this course. Is very obvious pretty quickly when you don't do the reading, because you're missing major components of what you need to learn. And I think that most of you are in internship by now. And so hopefully you're seeing this as more than just an academic exercise, but you're going to be using these models with your clients. And that is what this is about, exposing you to more models of therapy, giving you expertise in them. So you have to do the reading. You can't just skim over the top and hope to have an understanding of this. And then I want to say just a couple things. I know a few of you in this class have already done your capstone. Some of you are getting ready to do it, and all of you will do it eventually. But this and Family Therapy 1 are really important courses in terms of choosing a model or models that you want to integrate and utilizing them for your capstone project, both to articulate that in your paper and in your presentation, but then to demonstrate it with a client system. So as we're going through the next few weeks, be trying out these different models with your clients and seeing, which are the ones that really fit me and fit how I want to work with clients. And then that gives you one step ahead in getting ready for your capstone, because that really is a big project and kind of the compilation of everything you've learned over these years. So I look forward to seeing some of you in the synchronous video chat tonight. I'll post a Zoom link so you can come to that if you want to. It's certainly optional, but if you have questions about the assignments or the course in general, come on, or if you just want to talk for a bit. So that'll be from 6 to 7 Central Time, and I look forward to seeing you. So let me know if you have questions. Bye.